Welcome back. November is also Lung Cancer Awareness Month. I recently spoke with a 14-year survivor of lung cancer and the head of Jazz Pharmaceuticals, all about what you need to know about lung cancer. Let's take a look.
November is Lung Cancer Awareness Month, but did you know that there's more than one type of lung cancer? 13% of patients have an especially aggressive type of the disease called small cell lung cancer, or SCLC, but there is hope. Joining us now are Montessa, a 14-year-old SCLC survivor and advocate, along with Abizer Gaslightwala, head of U.S. Hematology and Oncology at Jazz Pharmaceuticals. They are going to share the latest news surrounding this challenging disease. Thank you both for being here today.
Thank you for having us.
So, Abizer, what is SCLC?
Sure. So SCLC stands for small cell lung cancer. It's about 13% of all newly diagnosed lung cancer cases in the United States every year. But unfortunately, those 13% of these cases have typically a worse prognosis and outcome than non-small cell lung cancer. This is really important because as patients learn about a diagnosis and think about treatment options, it's important that they get the most up-to-date and critical information from other patients and caregivers, as well as their doctors, to help inform their long-term outlook. And often we want to make sure that there's not misinformation or information found on the internet that could be outdated or misguided.
Montessa, tell us your story about being diagnosed with SCLC and your journey with the disease.
Sure. In 2006, at the age of 28, after two misdiagnoses, an X-ray would cause my life to stop as I knew it. That X-ray revealed a 15-centimeter mass, the size of a cantaloupe, a tumor in my chest that eventually would lead to a diagnosis of small cell lung cancer. My oncologist, he nonchalantly said, yeah, you've been diagnosed with small cell lung cancer. And I had to look it up on Google Doctor when I got home because he said it so calmly, I did not understand the significance of it until I got home and saw that the prognosis rate hadn't changed in the past 30 years. Lung cancer was severely underfunded, even though it killed more people than breast, prostate, and colon combined. And I decided to join some advocacy groups. And through that work, I said, wow, there's a disparity even between lung cancer patients. I saw things moving and research posters being done for non-small cell, and I felt like small cell lung cancer patients were the forgotten stepchild, and I vowed to say we are not forgotten, and I wanted to be a voice for patients like myself.
Abizer, what is the latest resource provided for people with the disease?
Sure. So we at Jazz Pharmaceuticals heard stories like Montessa and others and decided that there was a unique need to create a resource and a tool that focuses singularly on the small cell lung cancer diagnosis and treatment journey for patients and caregivers. We created Nothing Small About It, which is a digital online hub platform. And on this site, you'll find a number of things, including patient testimonials from Montessa and patients like her, as well as their caregivers that really give insight into their experiences, their emotions, but also provide education, inspiration, and empathy for these patients and caregivers as they learn about the disease. In addition, the other resources on the Hub website include tips on thinking about how to create a support network, on tips on how to live day-to-day life in terms of health and wellness, as well as considerations for treatment options that a patient and a caregiver should think about for this disease.
Montessa, what advice do you have for other patients diagnosed with SCLC?
I would suggest to other patients that they build a support network around them, whether it be family, friends, other cancer survivors, especially people that had lung cancer and small cell lung cancer, so that they can walk that journey together. It's nothing like it to have somebody go through that same experience. And I've had a unique opportunity to sit here for 14 years at this table and see the needle now in the last year moving to an area focused for patients just diagnosed with small cell lung cancer, a one-stop shop, as Abizer was talking about.
And once again, where can people go to find out more about this program and the disease?
Sure, super simple. It's www.nothingsmallabout.it, all one word, .com.
Well, thank you so much, Montessa and Abizer, for joining us today. Really appreciate your time and this great information about SCLC. Thanks again for being here.
Great. Thank you for having us.